Now, Erie's premier podcast. News about music, health, and what's happening. It's Breakfast with Nat the Hat in the 814. Sponsored by Erie Insurance.
Mental health in America is a critical and complex issue, reflecting a range of challenges and opportunities for improvement. What is the widespread impact? Mental health disorders affect millions of Americans. According to the National Institute of Mental Health, nearly 1 in 5 U.S. adults live with a mental illness. Mental health issues are particularly prevalent among young people. The CDC reports that anxiety and depression are common among adolescents, with increasing rates over the past decade. Suicide is the second leading cause of death among those aged 10 to 34. So today, I welcome to the podcast, and this is number 43, Janana Evankovic. Am I good with that?
Ivankovic, but you're
Ivankovic.
good.
That's a tough one, kids. She's the marketing and communications coordinator, and also Abby Schick, events and fundraising coordinator for NAMI of Erie County, PA. Ladies, let's get acquainted. Janana, tell me about your background and why your name is so hard to pronounce.
Yeah, absolutely. I get this question a lot. So I was originally born in Bosnia in Europe, so it's kind of to the west, I think, of Italy. And I came here when I was 2 years old. So, yeah.
Right to the 814.
Yes.
A bundle of joy in
Correct.
the 814.
In 2001, and ever since been here at the 814.
Janana, tell me your background and how you got involved with NAMI.
Yeah, absolutely. So I went to Penn State Barron and got an undergraduate in marketing and a minor in communications. I started off at a few different jobs, and then I was interviewing, and I came to NAMI, and I always wanted my next job to be something that has a purpose, where I feel like we're making a difference, and just to know the impact you get. And that's exactly what we get here at NAMI. We get to see those, individuals we're helping every single day, and their feedback and letting us know how much we help them. So it's been absolutely wonderful. And as soon as I did the interview, I went home and I was like, that's the place I want to work.
Nice.
Yes.
And that's the passion that you need to bring to the table. Where is NAMI located?
So we're actually right here on Peach Street as well. You can head on State or Peach, but our address is 1161 Peach Street. 1611. Sorry, I get them mixed up. 1611
That's okay.
Peach Street.
I get things mixed up all the time.
Yeah.
Trust me. Now, Abby, and I've been going back and forth with you to try to get you girls on. Abby, tell me about your background. Were you born and raised here?
No, I'm not from here at all. So I'm originally from Pittsburgh, and I went to Edinburgh, and I had originally gone to Edinburgh for speech language pathology, but I learned quickly that was not for me. So I switched to strategic communications, and then I did a 4+1 program there and got my master's in managerial and leadership communications. So
Wow.
a lot of communication degrees. And then,
You are stacked educationally.
I guess, yeah. Yeah, so then my fiance and I bought a house here and moved here, and we've been here ever since. So I've been in Erie County for 6-7 years now, but I'm from Pittsburgh.
Right. What's your background? What brought you to NAMI?
So a lot of people in my family, a lot of my friends struggled with mental health, and I think it was subconsciously a place where I wanted to work, a field I wanted to be in. But candidly, I was just kind of looking for a job, period. But then I saw that NAMI was hiring, so I was like, oh, I'll try, and I got it. And
Nice.
I've kind of had different roles. So 2 years will be this month, actually, in like a couple weeks. I'll be there for 2 years. So I started as a program specialist, which was part-time, and I worked my way up to full-time as events and fundraising coordinator.
Events and fundraising. Very, very important for a nonprofit organization.
Yeah, essential.
And that's it. A lot of networking involved there. So let's start with the mission of NAMI. When did NAMI come to be? Wasn't it in the 80s sometime?
I think
Am I
so,
right?
yes.
Okay.
Yeah, it's been around, so we're part of a bigger affiliation.
Is that countrywide? Or,
Yeah.
Okay.
Yes.
National, yeah.
Yeah,
Okay,
national.
it's a national.
And we here, I can't remember since when we've been here in Erie
This
County.
year is our 40th anniversary.
Yes.
Wow.
So, yeah.
So you've been around a long time.
Mm-hmm.
40th anniversary. That's something for an event and a fundraiser.
Yeah.
Correct?
Yeah. Yeah.
We'll talk
We're
about
trying to tie it in.
A little bit.
Absolutely. So let's talk about the mission.
Yeah, so our mission is to provide education, resources and advocacy for our community. So we do a lot of things like offering peer support groups, family support groups. We offer classes as well. We also go into other organizations where we provide mental health first aid.
Nice. I
Yeah.
love that. I did not know that.
Yeah, we actually, the nice thing about us is we provide everything for free. So that's something we pride ourselves on is we go to businesses, local individuals, communities, like anything, and we're providing it all for free. We even have art support groups with like little kids and elderlies that we do. And again, we go there, spend time with them.
So what you're saying is a lot of your programs, you go to the place to help. Not a lot going on under the roof there at NAMI, is what you're saying.
We have two support groups. We have a peer support group that we host on Wednesdays.
Okay.
And then a family support group that we host on Thursdays. But those are our only in-house programming right now. We go into...
I love that.
Yeah.
You go out into the field. That's great to know. You know, the stigma, despite growing awareness, stigma surrounding mental health remains such a significant barrier to seeking care. So many individuals avoid treatment due to the fear of judgment or misunderstanding. What has NAMI done to break down those barriers on the stigma?
One thing we're doing actually is I'll let Abby talk a little more on the event side, but one thing that we're doing, Abby and I, we actually are hosting our own podcast. So it's called the Stigma Stompers. We're on Spotify.
I love it. Where can people find the stigma Stompers?
It's on Spotify.
Okay.
We're now on iHeartRadio, and we're also on Amazon Podcasts.
That's great. So
Yeah.
are you doing a podcast once a week as well?
So we're actually doing it twice a month, every second and fourth.
Is it the both of you?
Yes, we're the co-hosts.
Wow! So here I am trying to get you all calm and slip you into this podcast and just saying it's like having coffee and you got your own thing going on.
Yeah.
That's the Stigma Stompers. So what do we talk about during that podcast?
Anything and everything having to do with mental health. This month, for example, is National Recovery Month, and then National Suicide Prevention Day is September 10th. So this month we have episodes with some people regarding substance misuse disorders, things like that. But we've had men's mental health. We've covered athlete mental health. Back to school. We're covering winter blues in December. So
Ooh, that's a good
everything.
one. So what podcast are you on right now? Do you count them like I do? Because
Yeah.
I appreciate knowing how many times
The
I've
one
done
coming
this.
up on Monday is actually episode 15. So we're fairly
You're
new
fairly-
to it.
I
Yeah.
Started in
love that
February.
you
Yeah.
can just... Ladies, it's a pleasure to have you on.
Thank you. We
I mean, I'm at
appreciate
number
it.
43. I'm grooving right along. And then I always say, when I hit a new milestone, I'm like, 20, 30, 40. I'm like, whoa, I've been talking a long time.
Hey, it's okay.
So do you have on your podcast, The Stigma Stompers, do you have these people come on or do you take phone calls? How does that work for you?
So usually we have them come to the office.
Nice.
The one for men's mental health, we had to accommodate, and we just did it via like Teams and recorded that, and then just used the audio from that recording to.
That's
upload
perfect.
it.
So that's what you do. You record in Teams. Nice. Well, access to mental health services, it varies widely across the country. Rural areas in particular often suffer from the shortage of mental health professionals. What type is NAMI just in Erie, or have you stretched out into the counties to help out there? How does that work?
Our NAMI Erie County just serves Erie County, but there's NAMIs that serve all across Pennsylvania.
Good.
So they're definitely getting everywhere, and we serve all of Erie County, including the rural parts of Erie County. So we've done tabling events in Corey. If you need programming in Corey, we'll traveled, Corey. So
Sure.
we'll come to you if you need us to.
That's great. Back to stigma for a moment. I can't tell you how many times, and these are family members that have had some mental health issues, and then they think that they don't need their medication anymore. I am sure that happens quite a bit.
Yeah, we definitely see that. So one thing about us is we're non-clinical, so we just provide the resources, but we have seen individuals we interact with who, they really don't want to use the medication. The advice we have is definitely consult with your doctor. Talk to them before you want to stop, because I know sometimes it might not be a right fit for everyone, but definitely make sure you're talking to your doctor if that's something you want to do and working with them.
So you aren't involved in the prescription
Correct.
of okay, that's good to know. So you're going to provide all them services to an individual and then have them contact their doctor or to make sure that they are getting the right medications.
If you're needing medications or needing therapy or anything, you can call us and we can refer you to a psychiatrist, a therapist, what have you. And there's a resource guide. It's Erie County Sprout. And it's what we use every time we get a call. We click through it, and people tell us what they need, and we can filter it.
That's great. Yeah, Sprout is great. Well, there are notable disparities in mental health care access. The outcomes across different demographic groups. So racial and ethnic minorities, the LGBTQ plus individuals, and those with low socioeconomic status often face additional barriers to receiving adequate care. So what does NAMI do for those organizations and those disparities?
So we actually had podcast episodes specific for LGBTQ plus and
During Pride Month?
yes,
Beautiful.
yep. And for minority individuals where we discuss, the facts behind it. And so I feel like we can talk a lot about, how significant it is, but we try to include the facts and numbers associated to it to try to get people to really understand how much of an impact it has. And we bring in guest speakers as much as we can to talk about, the resources that are out there for these individuals or give advice that, maybe they wish they would have had from someone else in the community. We just really try to do that. Plus, we're open. We make sure everyone knows that we're accepting no matter who you are. We accept everyone in our peer support groups, family support groups, all of that.
Speaking of, I was going to ask you about the support groups. What are the various ones and which ones can they take right at NAMI?
Every Wednesday is our peer support group. That's for if you yourself are experiencing some sort of mental health challenge. It's from 6 to 8, I think, every Wednesday night. We just ask that people register so we can call you ahead of time and kind of make sure it's a good fit. Same with our family support group. That's every Thursday at the same time in the NAMI office. That's for if you have a family member suffering with a mental health challenge and you're looking for ways to best support them. So those are our two public ones, but then we have a ton of peer support groups within other organizations. So if you're a part of those organizations, you can take part in our programming.
Great. So how can someone access? Do we need to go onto your website to access those
Yes.
groups?
Yeah.
Can you give me your website?
Yeah, NAMIErie.org. You want to make sure you type in the Erie since there are a lot of NAMI. So NAMIErie.org.
Gotcha. I welcome to podcast 43. Here we go. Janana Ivankovic.
Yes.
Oh my gosh. I thought, yay, I'm getting good. Marketing Communications Coordinator, and Abby Schick, Events and Fundraising Coordinator for NAMI of Erie County. Success stories. Do we have any success stories?
We have one. So she turned from participant to facilitator.
Love that.
She found us through one of our family-to-family classes, which that class is sort of similar to family support groups. So it teaches you the resources you would need to support your family member suffering with any kind of mental health challenge. So she took that class and then started becoming a regular member of our family support group, and now she facilitates some of our programming.
Yeah.
And you're practically downtown as well. And of course, we're up here on the 11th floor at 10th and State. But there are so many homeless people that suffer from mental illness. How do they just come off the streets to you, or how does that work? Do you reach out?
So some of our programming, like we work with MHA where we see a lot of, homeless population. and we work with them there. Sharon, I think she would be okay with us saying her name. She's one of our facilitators, and she really does a good job connecting with individuals. And, through different programs, we work with Stairways and a bunch of different places where individuals seek out help, and then they get connected to us that way. So we're out in the community, and I think the most where we see the homeless population, I would say, is at MHA, and that's how we connect with them. And
that's right over here, too.
Yes.
Okay, because I see them there. MHA is the Mental Health Association.
Yes.
So you're tied in with that organization. Stairways, too. Any others that we want to mention?
We have a
lot. We're in a lot of similar organizations that do similar work, so like MHA and Stairways, but then we also do programming with St. Martin's Center.
Nice.
We're with the MLK Center. We had a presentation with some banks. We did Marquette Savings Bank, PFU. We're in a lot of, the list is very long.
So thank you. So as a company, a company can get a hold of you and say, hey, we want you to come in and speak.
We encourage it, yeah.
And encourage, about mental health, because that is a huge issue today. So then you go out and do that. So you are educating
Correct. Yep.
people. Great.
Yeah, we encourage, no matter, it doesn't have to be a company, anyone. I mean, we even did mental health first aid for the whole Mill Creek Police Department.
Yeah. They were the
first. Nice.
Yeah.
They were the first in, I think, northwestern Pennsylvania, where the whole department was trained in mental health first aid. So that was very cool.
That's important as police officers. And I know there's a liaison over there now. I can't think of his name, but he was on my show quite some time ago discussing Mill Creek and, being with the officers as they go out and about. How about Erie? Anything going on down at City Hall? They've done anything in regards to mental health with their police department?
We train. So they do trainings across the board on just resources. So we got to go in and train the whole department on burnout. This is more catered towards taking care of themselves, which is equally as important as taking care of the people
Absolutely.
They serve. So we presented about burnout and secondary traumatic stress disorder, which is pretty much what they see every day. They're seeing a lot of individuals living the worst day of their life. So secondary is whenever you're witnessing a trauma happen to someone else. So we educated them on that. They didn't necessarily know that was a thing. And then just general PTSD too.
So when they are, speaking of police officers being out on the street and going through a crisis with somebody that is in trouble mentally, what are some of the things that you tell them that they need to do in order to calm this person or individual?
I think it's really important to just listen to them. A lot of the time, someone going through a crisis just feels unheard. So just listening to them, kind of listening to where they feel as though they would be best taken care of, and that's almost never in a jail cell. So they've been educated on where to take these people that need the mental health help, which is normally crisis services. That's one of the places we recommend first, or the CRU, the Crisis Residential Unit.
So, I mean, basically the bottom line is to be a good listener.
Yeah.
Right?
Yeah.
When you get started and let them speak. And then take it from there. Do the police officers, either in Mill Creek or Erie or anywhere in the county, do they go take them to a certain place, or are there many different places that they can go? Because I know how many places, like hospitals or whatever, can accommodate somebody having a severe mental illness.
It really depends on the capacity and how full they are.
I know
the hospitals have psych units, so it kind of depends on how many more people they can take that day. There's crisis services, and if you call them, they can find places for people to go.
Okay.
There's also the Crisis Residential Unit, where you can go there yourself, or the police can take them there. It's kind of a lot of the times calling around and listening to what it is they need, and then going from there, and then calling around to the services in Erie.
Right. And I think about that because when somebody is confused like they are, and you'll see a lot of this in downtown Erie, it's when a police officer comes, they're automatically defensive because there are times that they're getting themselves in trouble and they end up behind bars. And nobody wants somebody that is mentally ill to be behind bars because
They're not getting what they need.
they're not going to get what they need. And I've known people that have gotten themselves in trouble mentally and end up behind bars on 19th Street. And I'm like, that's not where they need to be. They need help. They need instruction. They need to get their medication taken care of. You know, there's so many factors. So I am hoping that the continuation with the police departments is good. So we're not doing that to people that just need mental help.
They definitely are learning and are putting it into practice, which is really great.
Glad to hear that. That's important stuff. Well, the impact of social and economic factors come into play. Economic instability can exacerbate mental illness. So what does NAMI do? What did they do during the pandemic? The surge had been incredible.
I wasn't there at that time, so
Neither
I can't
was
really
I.
speak to that. We're a fairly new team.
We're definitely seeing the impacts that COVID had, though. So I've gotten quite a few calls of people calling in. Their mental health is being affected by their financial situation. They have been jobless since the pandemic, or they need help finding a job, which ties directly to someone's mental health. I mean, if you can't afford your bills or rent, then you're going to struggle mentally. So we've had a lot of people call in about that. And I would definitely say that's aftermath of COVID-19. So we're
and especially with children. Do you see this increase with children? Because I've had others on that have discussed how important it is to have somebody in place at the different schools and the school districts, because they're seeing so much of that today since the children were isolated, had to stay indoors and very, very scared over COVID-19. So do we get into the school districts at all with NAMI?
We do.
Yeah.
Tell me more.
So one of the main things we're doing is our youth mental health first aid for the teachers and school staff, and then teen mental health first aid for the students themselves. And teen was originally, I think, for just 10th through 12th grade, but now it's for the whole high school. So mental health first aid is essentially like CPR for your mental health. So it teaches you what to do in the event of an overdose or in the event of a crisis situation where a peer might be having suicidal thoughts. It teaches you how to have that direct conversation. So we're going into the schools and doing that with the older kids. And then middle and elementary school, we do Exploring the Arts, which is early intervention and teaches them emotional regulation through art. So it makes it relatable and kind of easy to teach and easy to understand. So we'll go in with like a book, and we'll have an activity where they do art and they get to talk about their feelings, and they learn kind of, maybe being angry all the time is not normal, not how I need to live. And so we teach them kind of coping skills, and we also do lunch and learns for older kids so they can sit through a presentation and kind of learn about basic topics like depression, anxiety.
Well, go ahead.
Oh, sorry. I was just going to say, and
Giovanna.
it really does have an impact, because I know one of the schools I did Exploring the Arts, and when we were coming to an end, because school was ending, we had kids come up to us and to the staff of the school and say, I want to do this again next year. Can we do it over summer? Like, they really see the impact. And like Abby said, we tie it in with art so they can learn, but also have fun in the way that they're learning.
I have witnessed, like family members that get into like 5th and 6th grade and things start changing mentally for them. So, I mean, the arts, that's got to be a great program as, showing them, because once they're in high school, they're beyond, not beyond, I don't want to say beyond, but in high school is tough. You know what I mean?
Yeah.
Where and the social media and all those different factors that play into the phone that they have in their hand. So what are we doing about that?
So one thing we actually do is we have an annual movie night. So I know last year, Abby can talk more about that. We did Inside Out 2. And this year we did Luca, which is we're trying to explain to the kids, but it's open to anyone. It doesn't have to be a kid. You can come as an adult as well to the movie night. And last year we did Inside Out 2, like I said. And what we try to do is just explain to them, the different emotions. I don't know if you've maybe seen Inside Out.
Yes.
And the different emotions and that it's okay to have those emotions and things like that. And I know we put packets together and, interactive for the family members. We try to kind of teach them on, the different emotions and that it's okay to feel those. And I think we really try to emphasize that if you feel like you're struggling, it's okay to ask for help.
Right.
Yeah. We're essentially trying to teach parents and kids what to look for in each other. So we're trying to teach parents that, they're young and maybe they haven't been through what you would think would be a lot, but for them, they're experiencing all of this for the very first time.
Traumatizing.
And it's a lot to go through. So I think sometimes mental health in kids is sort of diminished because they're young. They're young. They haven't been through that much, but they can have just as much anxiety as a full-grown adult. I mean, there's test anxiety where the thought of taking a test is literally debilitating and they can't do it. So then they're having failing grades and then their mental health is impacted even more. So it's like a snowball effect. So the earlier we can teach kids how to handle their emotions, the better. And if they weren't taught it at a young age, we'll still go through it with them in high school and teach them, here's what to look for on social media. Here's what to steer clear from. Here is what cyberbullying looks like. You might be being, you might be cyberbullied. Yes. We're just teaching them everything we can as quickly, not as quickly, but we're trying to push in quickly.
Yeah.
Right. Because I know how many kids they get into high school and, these phones have just created havoc. I am so glad when I was growing up, and I'm an elderly woman, but when I was growing up, we didn't have that.
Yeah.
There were bullies, and of course there's always bullies, but now you're taking it to a new level where you're, saying things about them and putting their pictures on. And there are so many things that these high schoolers are struggling with because it's just a way to give them anxiety to a point where they do have suicidal thoughts.
Yeah.
Yeah, and I feel like for kids and high school students, I mean, they're still technically kids, but a lot of times when they are getting bullied, I feel like they're ashamed and they feel like, if I ask for help, it's just going to be worse because it's going to turn into a big scene. When that's not the case. I mean, if you do it the proper way, I feel like the first step is definitely talking to a parent or a staff member about what you're going through, because there are ways to handle it without it getting out of control. But I think that's the common misconception for students and kids, is that they feel like it's going to get out of control and they'll get even more bullied.
Right. And as a parent, you have to be proactive at all times today. Limiting their time on the phone and taking a look at what they're doing. And because there's all kinds of parental controls on a telephone. I mean, that's your computer in your hand. So I think it starts from top down as a parent to make sure, because I don't know, everywhere I go, everybody's got their head down on their telephone.
Yeah.
It's really a new generation.
I feel like, and I'm not a parent, but I am a child, obviously. So I don't want to tell anyone how to parent, but I think it is just as simple as just talking to your kids. Just
knowing what's going on with them.
Knowing what's going on, letting them know that you are a trusted adult in their life that they can go to with whatever it is they need. Or whatever it is they're feeling. It's just as simple as asking them about how their day is and making it really intentional and not just asking just to ask.
Right. And sitting down and having a meal together is nice. You know, I can remember, and we had 8 kids in my house, so you had to be there at 4:00, sit down, or you didn't get anything because the food was gone. But I mean, it was a good way to connect with your family and ask how your day's going. And as a parent, and of course, I'm a parent too, you know when things aren't right. You can feel that. What are some of the warning signs? I know it's like not taking care of your bedroom and not taking care of your personal appearance. What are some of the other things that a parent would look for in their child or young adult?
I would say changes in behavior. Isolation is a big one. If you see your child is isolating, maybe they used to be very social and, hanging out with friends and things like that. And all of a sudden you see that change where they're closed off. They're really not talking much. They're just in their room. That could be a sign. Also, another thing is if you see that your child is hanging out with I know one interview that we did, if your child is hanging out with a new group of individuals that might not be the best for your child, it could also mean that there's something more going on. So I think like we discussed right now, just having that open communication with your child and asking them those tough questions. I know, like, if you think your child might be suicidal, ask that question. One thing that we teach in mental health first aid is that if you believe someone might be suicidal, ask them. And a common misconception is individuals might think, if I ask them this question, I might put it in their head that, to commit suicide. But that isn't the case. You asking that question can be the next step to having that open conversation and taking the proper steps on how to help that individual.
And we're right back to the stigma again.
Yeah.
Because nobody wants help. And, I think taking that first step is saying, I need help. And let's be honest, ladies, we have all had our mental health issues.
Yeah, absolutely.
I've been able to control them without any medication. I've had a lot of depression and anxiety over losing family members, and you know what I'm saying. So there are, like I said, we go back to the stigma or whatever. But I wouldn't be afraid to say, really, I do need help right now. I need to go talk to somebody. I need to work this all out. That's the deal, and it's okay to say, yeah, I think I will. Go speak to somebody. I truly, as I look around me, and a lot of the 30-somethings that I've been in contact with, all of them are taking medication and working out those issues that they need to be able to be healthy and adults that can go out and make a difference in our community. And you can't do that when you're in your head all the time.
Yeah.
Right?
And I think one thing is that, I personally have had and still sometimes mental health challenges. So when you look at it, I was, afraid of asking for help, especially at a younger age. But now that I'm older and looking back, I wish I would have, at least understood what mental health is at a younger age, because I feel like it definitely helps when you, I don't want to use the word attack, but like, you take care of what's going on at an earlier age. And if you understand, like, I had stress anxiety, I would feel sick to my stomach, go to the doctor, do all this testing, and everything comes back normal.
How many people have gone to the ER with anxiety attacks?
Yep.
Think about that.
This happened recently to someone I know. They went to the ER because they actually thought they were having a heart attack, but it was a panic attack.
Yeah.
Right.
So the symptoms of mental health can present physically as well. So a lot of the time people think they're having a physical what have you, but it's actually their mental health.
And the stigma, like I said, that's where it all starts. But the bottom line is, if you don't reach out, then you continue, and that slide can get very
steep and slippery.
Yes.
Yep.
So you need to do that. Substance abuse disorders are closely linked to mental illness. We know that. And with the opioid epidemic in particular, it's had devastating effects on our community as well as across the country. I've lost family to substance abuse. And with many of these individuals struggling with co-occurring mental illness and substance use abuse, How does NAMI address those? If somebody comes to you and says, I have a substance abuse problem, and normally those that have that abuse problem are because they are not mentally able to cope. Think of those things. So many, young adults turn around, and that's why they go into this abusive stage with substances, because they are having mental issues, correct?
Yeah, absolutely. That's actually this month's podcast. We talk about the co-occurring, and they say, I think almost all their cases that they get who have substance misuse, it is linked with mental health challenges. And I think what we are able to offer is we offer them our peer support group. We also, depending on what they're struggling with, we offer them, like, we work with Cadenzia and different
Stairways.
resources. Yeah, we will offer them like those resources that they can contact to get that help that they need. But what we can offer them on our end is more of this peer support group.
It's definitely dependent on where they're at in their journey as well. If they've never sought out any kind of residential treatment or long-term care for their misuse disorder and their mental health challenges, that can be a very different referral compared to someone maybe that is way farther along but just wants a little bit additional support with like a peer support group. So it really depends on who you are and where you're at on your journey whenever you call us.
The U.S. government has made efforts to improve mental health care through legislation. Do you have anybody on board that takes care of advocacy for the mental health
I feel
in your
like
community?
kind of all of us in a way are working
Advocate.
towards it. I wouldn't say like legislature wise.
Yeah.
No.
Right.
But just speaking out in the community and doing our programming, I would say all of our facilitators are advocates in some shape or form. The one for sure is Sharon.
Yeah.
She's had quite the history in her family. I won't get into it because it's
Right.
her story to tell, but she's incredibly passionate about mental health, substance misuse, what have you. So she, I think, is an advocate most of all. But I think all of us, if we're doing this kind of work, then I would say we're advocates.
Well, I believe that Governor Shapiro put in his budget, more for those struggling with mental illness,
Yes.
because that's at the top of the list right now.
Yeah.
It truly is. And I'm sure whoever does advocate on the Hill for us is, relaying these messages on just the increase of help needed with mental illness. So how does NAMI stay informed about the latest developments and research in mental health care? Is there somebody on your board or whatever that is in tune with that?
I feel like mostly we try to stay updated. We go to conferences. We get trainings ourselves as well to stay informed of what's going on in our community. Our team is really supportive of that. I think there's a suicide prevention one we're going to be going to. We try to do any conferences, any trainings that we can, either one individually in our staff or all of us, to make sure that we're staying up to date on what's going on. And then also just, if someone hears something, we always make sure that we share it with the rest of the team so everyone's aware. I think that's more of what we do. I don't know if there's anything else you want to add.
We also work closely with the Mental Health and Intellectual Disabilities Office and the Drug and Alcohol Office. So they're more likely to get most updated stats first, and then they relay it to the people they work with. So we get updates from them, but then all of our presentations are custom and tailored and with the most up-to-date research. So whenever we're putting them together, we're doing the research ourselves and creating these PowerPoints and presentations for companies, organizations, whoever needed them. So we're doing the research ourselves.
And then, of course, we have 988.
Yeah.
988. And look how long it took for us to get 988.
Yeah.
Like, so people can call right away and when they're feeling the way that they're feeling. Abby, we've got a walk coming up that I know that you are thrilled to talk about because you are our fundraising gal.
I'm it. I'm the whole department.
So, I know the feeling. So tell us about the NAMI Walk coming up.
Yeah, so it's our first one ever, and NAMI Walks. It's our first ever.
Oh, I'm excited for you.
Yeah. So it's nationally, it's like our national fundraiser. So this is NAMI Walks Erie, PA. That's the formal title. It's September 15th. You can register online. It's completely free. The registration opens at 8 a.m. The walk starts at 9. There's going to be food trucks, Kona Ice, Sunday vegan ice cream, which is delicious, a DJ, a photo booth, free face painting, free glitter tattoos, all kinds of stuff to do the day of. Lawn games, resource fair. There's going to be a ton of resources there, including some of the ones that we mentioned. Like Safe Harbor will be there. So, yeah.
Raffle baskets.
Raffle baskets.
And
That's what we've been working on.
Oh, the raffle baskets.
Yeah. They're going to be really good.
I gotcha.
We got a lot of good
Where is this at? Where are we walking?
Penn State Barron. The kind of main hub is going to be the soccer and lacrosse stadium, but then the walk will be throughout campus, and it's not a hard walk.
Yeah.
So it's wheelchair accessible, stroller accessible, and you can bring your dogs.
Great. I was up there for the Highmark Walk, so it's probably very similar of where they're going to walk you. It's just a beautiful.
It's really beautiful.
So people can sign up and raise money and do all those things.
Yeah. Our walk website, so it's namiwalks.org/EriePA.
Okay.
And on there, you can read the frequently asked questions. You can register a team, which is completely free to register a team. You can also buy shirts from our shirt store. We designed shirts, and we get a portion of the proceeds from every sale. So if you want to support us that way, that is going towards the walk. You can create a Facebook fundraiser once you register a team, and you can have people donate that way and fundraise that way. So there's a lot of ways to get involved with it.
Well, Penn State Barron is beautiful in the fall.
Yes.
So it's a great walk to begin with. So the date is
September 15th.
September 15th. And what time you kicking things off?
8 a.m. registration opens, so 8 a.m.
8 a.m., then the walk?
9.
9.
Yep.
Perfect. So people can get involved with that. Anything else on the radar for the 40th?
Also this year, I brought flyers.
Awesome. We'll take your flyers. We love your flyers.
We're hosting our first ever Brushstrokes of Resilience art show with MHA and Stairways.
Wow.
Yeah.
That's great. When's that coming up?
So, this exhibit will open October 6th, but they're keeping it up through the new year. So,
Yay!
Yeah.
I love the art museum.
October 6th through the 10th, admission to the museum is going to be completely free. Ourselves and then MHA and Stairways are covering the cost for that week so that it's accessible to all of our consumers. And the exhibit is made up entirely of art from our consumers.
And can we purchase that art from your consumers?
You can. If it has a price tag on it, then it's for sale.
Wow. So that's the 6th through the 10th. You can go to the Erie Art Museum for free. And check out all the lovely art that your consumers are. That's awesome.
It's
and
a
it's
really
Stairways
good show.
along with
Us
who else?
and the Mental Health Association.
That's perfect.
Yeah. It's going to be a really, really good show.
I love it. So let's start winding down the show with talking about the future goals of NAMI. Do you have some goals that you're setting for yourselves
I think
in regards to, 5-10 years from now?
I feel like our ultimate goal, we don't know if this will be possible, but our ultimate goal is definitely defeating that stigma. What we like to say, yes, exactly. During our podcast, we say it all the time. We're like, as much as we enjoyed doing the podcasts, we hope that there comes a time where they're not needed anymore. That's the whole purpose of it, is defeating that stigma. I think that's like our ultimate big long-term.
That's like the goal.
That's it.
That
really is.
It's a goal that you kind of never reach.
Yeah.
Because I don't think it'll ever go away. But yeah.
I just think with your Stigma Stompers podcast, what we talked about today, hoping that our listeners out there are saying, okay, it's okay to go. And I mean, everybody else goes in when their heart's not functioning.
Yes.
You got diabetes, you got, pain or whatever the case may be. You're always going to your regular doctor.
Yes.
Why not see a mental health doctor?
And you can go to your primary care physician and bring up your mental health challenges, and they'll get you to where you need to be.
Yeah.
So you can go to the same person you would go to for your bone breaking.
Right. And that was the first time with my PCP, which he was new. He's a new guy. And I went to visit with him. And that's one of the first things he asked me. How is your mental health? And I said, you know what, Doc? That is the first time that I've been, going to my PCP doctor that you've come out and you've asked me. No, I've been struggling. I'm depressed. I've got some anxiety, not to a point where I do think that I need help. And he talked to me about it. He said, we got somebody right here, that we can send you to. It's a new way. And to try and kick that stigma to the curb. So I was really refreshed when he had said that to me. Because if you're not mentally well, next thing that's going to happen is you're not going to be physically well.
Yeah.
Right?
100%.
How many times people turn around and end up having things happen to them, and it's all because of their depression, their anxiety, so many other factors involved. So let's take care of our bodies and our head. It's that simple.
Mental health is health.
Yes.
Mental health is health. So does NAMI plan to expand its reach or improve any of its services down the road?
Yeah, we're definitely that's our goal all the time.
All the time.
I love it.
24/7, 365.
Yes.
Love it.
We definitely want to, inform the public that we're there as a resource for them. We can help guide them in the right direction. We want people to feel comfortable, know about us, and feel comfortable reaching out to us and saying, hey, I need help. Where do I go, or what can I do? We definitely want that for our community first and foremost. We're hoping that people join our events. It's to raise awareness on mental health.
Yeah, they're free.
Yes.
And that's the most important.
Exactly.
Everything we do is free.
I mean, we like to fundraise. We'd like to raise money for organizations, but at the same time, we need to realize that, like, you girls are passionate. You know what's going on out there.
Yeah.
And your all hands and your all hearts are in on making this community a better place. I appreciate both of you for coming in today.
Thank you. We
thanks for having
appreciate
us.
it. Yeah, and just to mention, all donations that we get go straight back to NAMI for these free events that we do.
Goes directly back into our
resources.
program.
Yep.
How
in
big's your
Erie.
staff? I meant to ask that. It's got
Six of us.
I was going to say slimlined. That's with most nonprofit organizations.
Yeah.
Very slimlined.
Full-time.
So yes, absolutely. Well, mental health in America is a multifaceted issue that requires a comprehensive approach, which I see NAMI doing, involving policymakers, healthcare providers, communities, and individuals themselves. Addressing these challenges can lead to better outcomes for millions of people, right?
Yep.
So thank you so much for helping those individuals.
We do it happily.
Yeah,
It's, I'm going to try this one more time. Janana Ivankovic.
Yes.
Marketing Communications Coordinator, and Abby Schick, Events and Fundraising Coordinator for NAMI of Erie, Pennsylvania. So thank you both for being on the show. And I always love to leave with a quote, and I love this by Elizabeth Kubler-Ross. She said, the most beautiful people we have known are those who have known defeat, known suffering, known struggle, known loss, and have found their way back out of those depths. These persons have an appreciation, I'm looking at two of them, a sensitivity, and an understanding, that is, of life that fills them with compassion, gentleness, and a deep loving concern. Beautiful people do not just happen. And thank you, too, beautiful people, for coming on the show today.
Thank you.
Thanks
And
for having
keep
us.
up the great work in the 814.
You've been tuned in to Breakfast with Nat the Hat in the 814, sponsored by Erie Insurance on 88.5 and 102.7 LECOM Radio.